Have you been dealing with sundowning in your older loved one? If so, you're not alone. This is a super common challenge when it comes to caring for people with Alzheimer's and other forms of dementia. So in this episode, I'll explain how geriatricians handle it. Hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and founder of the website betterhealthwhileaging.net. And this is the Helping Older Parents video podcast, where I cover the best ways to support aging parents and other older loved ones so they can live better lives in their later years. I also often address common caregiving concerns and dilemmas, like what to do if you're worried about an older person's memory or safety, how to deal with Alzheimer's and other forms of dementia, and how to help your older loved one get the care they need. So, in today's episode, I'm going to explain a very common phenomenon that comes up in Alzheimer's and other forms of dementia, also can come up in people who've been diagnosed with mild cognitive impairment, and that is sundowning. So this term basically refers to difficult behaviors that tend to come up later in the day. And as I know many people find themselves struggling to understand this and to deal with it, I've decided to do a few episodes on it. Specifically, in this episode, I'm going to cover what is sundowning, what causes sundowning, signs and symptoms to be aware of, and then I'm going to go into a little bit sundowning versus delirium versus other forms of agitation, because these are all things that commonly affect people who have Alzheimer's or other forms of dementia, and that you'll want to know about if you're taking care of somebody like this. I'm going to talk a bit about medications for agitation and sundowning, and then I'm going to talk about some specific ways that you can manage this issue to make it better and to help it happen less often. So we're going to get into that. But before I do, I have a very quick request, which is if you're here and you find this topic interesting, or you've been finding this video podcast interesting, if you haven't subscribed yet, if you could please go ahead and subscribe, it would mean a lot to me. It does help me out, and it helps other people find the channel when you subscribe, and it helps support the work that I'm doing. Okay, let's get on to sundowning. What exactly is sundowning? So sundowning is actually not officially a medical term. It's not a medical diagnosis. It's a commonly used term that refers to difficult dementia behaviors occurring in the late afternoon or evening, especially. And it's very, very common. This affects up to 2/3 of people who have Alzheimer's or another form of dementia. And if you're actually wondering about the difference between Alzheimer's and dementia, I do have a video that covers that in depth, and you'll find a link to it in the YouTube description here. So why does sundowning happen? So it turns out that Alzheimer's and other forms of dementia commonly involve something that we call, in medical terms, neuropsychiatric symptoms, sometimes abbreviated NPS, along with the cognitive difficulties. So sometimes people think Alzheimer's is just about having problems with memory or another aspect of thinking, and that is definitely true. And along with the cognitive symptoms, people very commonly have these neuropsychiatric symptoms. And by neuropsychiatric symptoms, we basically mean difficult or strange behaviors. I'll show you a whole list of them in a moment. But in general, these symptoms tend to emerge or worsen, especially when a person with dementia has become tired or has otherwise kind of reached their limits or their capacity, when they're kind of at the edge of their cognitive reserve. There are also other factors that researchers have identified that are related to this. So one is circadian rhythm dysfunction. So we all naturally have a part of the body in the brain that manages our circadian clock, that kind of keeps track of our day-night cycle, our 24-hour clock. This does get damaged and affected in people who have Alzheimer's and other forms of dementia, and it's thought that sundowning is related to this. It's also thought that lower light levels in the later day and early evening play a role as well. And then late afternoon and early evening is also a time when things might be changing around the person. So somebody who lives in a residential home might be experiencing shift change, which can create an additional stressor or point of confusion that can cause these behavioral symptoms to emerge. So what are these neuropsychiatric symptoms of dementia? And I also commonly just think of them as difficult dementia behaviors. And yes, they often happen in the late afternoon or evening. But if you've been taking care of someone with Alzheimer's, you may have realized they can happen at any time of the day, right? So these include symptoms such as aggression, right? Irritability, anxiety, apathy, kind of lack of interest in things, wandering or pacing, being restless, disinhibition, which might mean taking off clothes, in places where one doesn't usually do it, or starting to say things, blurt out things that normally one wouldn't say. Disinhibition also sometimes includes sexual behavior because the person is disinhibited and is not controlling that the way that they normally would. These behaviors can also include delusions, believing things that aren't true, including paranoid delusions, accusing people of having taken something or done something or plotting something. Then there are also hallucinations. This means seeing things or hearing things that other people don't see or hear. Also occasionally possible to have hallucinations that involve other senses of the body. Then there's depression is also considered a neuropsychiatric symptom of dementia, as are sleep disturbances. So before I go on about sundowning, I now want to say a few words about sundowning versus delirium. Because for us in geriatrics, whenever we are told somebody is sundowning, we actually really want to consider the possibility, could this be delirium? So the key point here is that difficult behaviors in dementia are not always sundowning. And what we want to consider as well is, could this be delirium? Or could this be agitated behavior that is in response to a particular thing going on? So what do I mean by delirium? Now, I'm going to do a whole episode just on delirium pretty soon, but briefly, delirium is a state of worse than usual mental function that is brought on by illness or another form of stress. So it does affect people of any age, but the older we are, the more likely, the easier it is to get it, I should say. You don't have to have Alzheimer's or another form of dementia to get delirium. Just generally, it takes more of an illness to become delirious if you're an older adult who doesn't have Alzheimer's or dementia. So it can take people who are cognitively normal and cause them to be very confused with fluctuating levels of alertness. Or in people who already have Alzheimer's or another form of dementia, it generally will make them more confused than usual, or possibly more spaced out or more fluctuating levels of alertness. So we see this really commonly in the hospital after surgeries, but it can definitely happen in the outpatient setting, at home, or in assisted living as well. And in particular, if you're caring for somebody with Alzheimer's or another form of dementia, you should know that it is much easier for these people to develop delirium. So some common causes include medications, especially medications that are anticholinergic. So those are the medications that interfere with acetylcholine, which is that really important neurotransmitter in the brain that actually tends to have lower levels in Alzheimer's. That's why Alzheimer's medications such as donepezil, brand name Aricept, try to increase acetylcholine. So those anticholinergics are everywhere in over-the-counter medicines and commonly prescribed medicines. I have a video about that as well. And then other psychoactive drugs, meaning medications that affect the brain in some way, either to make people sleepy or to otherwise modify their brain function. So those can prompt or worsen delirium in people with Alzheimer's. And then other common causes include infections of various types, electrolyte imbalances, dehydration, again, hospitalization, both because when people are hospitalized, they're sick, but also because hospitalization itself is a big stressor on people. Now, the important thing to know about delirium is that it usually comes on over hours. So if somebody has been having a worse than usual mental function every day for days on end, we wouldn't think it was delirium anymore. It's not really going to be something that happens due to a chronic illness so much. So is it sundowning or delirium? If it's a sudden worsening in behavior or cognition, in geriatrics, we always start by asking ourselves, could this be delirium? We better evaluate for possible delirium. And so that looks like asking about any medications, especially new ones, and especially asking about signs of illness and considering, could they have some kind of infection that we need to check for? And this could be a urinary tract infection, although not necessarily, or it could be another type of infection as well, or another form of significant medical illness. And if a person with Alzheimer's has a worsening in behavior or cognition or is getting agitated, we want to be checking for other common causes. So here are some causes of agitation in general to consider. Because when it comes to people with Alzheimer's or another form of dementia, agitation and other difficult behaviors often emerge as a response to common triggers. A really common one is pain. The person may be having pain, but may not be able to tell you, I'm in pain. Instead, they're just going to start acting up or acting out. Constipation is another one, and that's a form of discomfort or pain that is really, really common in older adults. I actually have a video about constipation on the Better Health While Aging channel, which you can check out. Frustration, just if they want something and they're not able to get it, they can act out. So what's causing the frustration? Is there a way we could resolve that? Fatigue, again, if people are just worn out, they may have just reached their limits, their capacity for the day, and start decompensating. Stress would be another cause. Are there new people around? Is there too much going on? Are they feeling kind of overstimulated, overwhelmed? Unmet needs of some type. Are they hungry, thirsty, cold, too warm? And then there's misperception. And by this, we mean not perceiving things accurately, often due to hearing loss is very common. Poor vision would be another cause, or just confusion. They're just misunderstanding what is going on. So, when thinking about sundowning, I would encourage you to sort of take a broader lens on it and think about how do you respond to agitation in your loved one with Alzheimer's or dementia in general. And here's what we recommend in geriatrics. First and foremost, you want to reason why, not reason with. So you don't want to start trying to explain to the person why they shouldn't be agitated or what's going on. Instead, you want to be internally asking yourself, what could be prompting this? What could be going on? What could be an underlying cause? And while you're doing that, to the person, what you want to lead with is reassurance and empathy. Help their nervous system settle down a little bit. And that often comes from taking their concern or upset seriously and validating them to a certain extent. And then you want to tailor the rest of your approach based on whatever is your best guess for what might be causing the behavior. So if it looks like it's late in the day and they're tired and overstimulated, can we take them to somewhere where they can sort of settle a bit? Can we provide some kind of experience that is calming and settling? Because generally, the reasons for why people are agitated are going to fall into one of these categories. They could be sick or have delirium. So this is especially true if you're dealing with something that is new, out of the usual pattern, has come on kind of suddenly. You want to be thinking about illnesses or delirium. Could they be having a reaction to pain or discomfort? Could they be having misunderstandings, misperceptions? Do they have an unmet emotional or psychological need? Or have they just reached an irritable stage, which is often because certain underlying social and physical needs aren't being met throughout the day? Or that irritability can again be because they've just gotten tired, they're stressed out, they're overwhelmed, or irritability can also come from irregular routines and them just not understanding what to expect. Last but not least, sometimes agitation is a sign of anxiety or depression as well. And we still want to start off by managing it in this way where we're looking for other causes and trying to figure out whether we can remove a trigger or otherwise kind of optimize their situation and keep them resilient. So people often ask for medications to deal with sundowning and agitation. This is understandable. It is very stressful to be with a person with Alzheimer's or dementia who is sundowning and getting reactive, especially if they're getting agitated or pacing or otherwise making things difficult for themselves and for people around them. However, before we turn to medications, there are some things that you should know. And the main one is that treating agitation with sedating, calming medication is possible, and we really want to use it as a last resort. There are no truly good medications for this. In recent times, we have a few newer medications that are FDA approved in recent years for this purpose, and nothing is still entirely safe and entirely ideal to use for this purpose. So medication should always come last, and we always want to do several things first. So again, first, make sure there's no illness or delirium. And then most causes of agitation or sundowning are actually best managed with non-drug approaches, including modifying how caregivers interact with the person, modifying or regularizing routines and activities, and finding ways to address the underlying unmet need or cause of irritability. It's also important to do some problem solving around identifying triggers or misperceptions and correcting those, because the goals are to reduce what brings on the agitation, to reduce the triggers, and to reduce how often the person is finding themselves in this state of decreased physical and psychic reserve. And then the other goal that we should set for ourselves when we're involved in the care of somebody with Alzheimer's or dementia is we want to learn better ways to address and de-escalate the agitated moments. So that being said, there is often a role for medications. So some medications are less risky than others and can help in some situations. So the ones we especially think about, for some people, melatonin as part of a program to try to regularize their day-night cycle and routine can be quite helpful. Cholinesterase inhibitors. So these are, the classic first-line medications for Alzheimer's. They include medications such as donepezil, brand named Aricept, and also rivastigmine and galantamine. Brand names for those are Exelon and Residine. Those have also sometimes shown to help people be less reactive. Other times we try SSRI antidepressants, especially citalopram has been studied for this purpose, can work for some people, escitalopram, brand name Lexapro as well, sometimes sertraline, brand name Zoloft. We might also try proactively treating for possible pain to see if the person gets better. And then if there's any sign that they might have constipation, laxatives, regularizing the laxative routine can be really helpful as well. So especially if there are frequent smears or, difficult to pass bowel movements, we want to think about laxatives and treating constipation as well. So these are medications we can try. However, they don't always help. And one of the reasons for this is that these medications sometimes are not addressing the many underlying causes for agitation. And so again, this is why it's so important to think about what are the underlying causes or contributors that could be driving this and how can we tend to those. That said, sometimes it is justified to consider stronger medications, especially if the person is creating a safety risk for themselves or for people around them. Now, the stronger medications, they do tend to work faster. So the ones I mentioned before are not necessarily going to get you an instant response. Most of the time, they won't get you an instant response. Stronger medications are sedating. They're essentially a form of chemical restraint. They do tend to work fairly quickly, but they do have risks. They both have the risk of making cognition worse, of impairing balance and causing falls. And then many of them actually in studies have been shown to increase mortality risk over the coming 1 to 2 years. So that's something to consider as well. So these medications include antipsychotics of various types and also benzodiazepine tranquilizers. So that means medications such as lorazepam, brand named Ativan. So we do use these sometimes, but we want to use them as a last resort. And we want to use them in combination with non-drug strategies and ideally at the lowest dose possible. So it's not wrong to use these medications. What we want to be careful about is jumping right to these medications before we've tried all the other things that are available for us to try and that end up being safer for people in the long run. And so again, especially if there's a safety risk for the person or caregivers, we want to consider these medications, but we also want to take a more holistic approach that really tries to address the person's underlying needs. Some other approaches to know about to reduce agitation and sundowning. So there are several non-drug approaches that have been studied. Often the studies have been very, can be small, but they've been quite promising. And they do show that it's often possible to help the person become less reactive. So some non-drug approaches that I want to encourage you to look into include, first of all, including structured exercise in the person's routine. People are sometimes irritable and reactive because they just haven't gotten enough physical activity and enough social stimulation. So if they're bored, restless, haven't gotten natural light or some sunshine, that can increase agitation and sundowning. So creating a structured routine that includes those things, especially exercise, has been shown to help many people with Alzheimer's and other forms of dementia. Another thing that has been tried is aromatherapy, especially lemon balm and lavender oil. And I think this works in part because the more we can sort of help soothe the person's nervous system, right, the less reactive they will be. And for some people, aromatherapy seems to help a lot. Music therapy is another one. So especially playing familiar songs. So many people respond to music, especially if it's familiar songs from earlier in their life that they have really loved previously. Pet therapy is another one, especially for people who love animals. This can be very soothing for them. And then there's massage and touch therapy. Now, you have to figure out how much touch the person is open to, but many people enjoy having touch on their hands, maybe like a little bit of hand massage. You can even combine that with a little bit of the aromatherapy. That can be really nice for people to help them have a more settled nervous system. So in general, ensuring that the person gets their core needs met in a calm, structured way will improve their resilience, and then they'll be less likely to be falling apart late in the day or to blow up when there's a little frustration or a little trigger. So if you haven't done this yet, taking a look at what is your loved one's routine look like? What does their daily routine look like? And can you help create a routine for them that includes adequate social stimulation, exercise, rest, outdoor light? For some families who have a person with dementia at home, getting them enrolled in a day program for people with dementia can be really great, because then they get out the door and they're in a place where a lot of these things are going to be provided to them. And that can help a lot as well to reduce agitation and sundowning as home. So, given all this, what do geriatricians generally recommend to reduce sundowning in people who have Alzheimer's or other forms of dementia? The general approach we recommend is, one, try to enhance the person's day-night orientation. So this means increasing exposure to daytime light. That helps people orient to that. Maintain a consistent schedule in terms of bedtime and wake-up time. Encourage daytime physical activity. Limit daytime naps. Next, as I was saying, have a consistent daytime routine that promotes well-being and avoids stressing the person in the late afternoon. So be sure to include social stimulation and enjoyable activities. These will depend on what seems to, do something for your particular person. For some people, it's gardening. For other people, it's music. Speaking of music, almost everybody enjoys music, actually. So consider music, touch therapy. Consider a little afternoon restorative time to keep people from getting to that really kind of overstimulated, overly tired phase late in the day. And then along with this, keep working on your own skills in learning to de-escalate and calm the person when they have become triggered or agitated. And along with that, think about how you can make sure that you aren't super tired when they are likely to be irritable, or at those times of the day when they tend to be more challenging, because especially if you are a regular caregiver for them, they will definitely pick up on your energy. And so if you are in a state of mind where you're easily irritable or frustrated, then the two of you are going to be basically amplifying each other's irritability and frustration. And that is a tough spot to be in. So to the extent you can, I know it's hard because often you're already working very, very hard taking care of them and taking care of everything else. But to the extent you can, see if you can avoid being super tired at those times when they're likely to be irritable. And that's what I have right now for sundowning. So hopefully this helps you manage sundowning with your loved one. I am going to do a follow-up episode very soon where I'm going to go into greater depth about the various medications that are options for sundowning. So if you've tried these things and you still want to learn more about medication, fear not, I'll be covering that in the very next video. Until then, thank you so much for watching, and thank you so much for everything you are doing for your older loved one. If you'd like to learn more from me or even get my guidance with your caregiving situation, be sure to take a look at the description for this video. There will be a link to a page where you can learn more. I also hope you'll subscribe to this channel. That's another great way to stay connected. So thank you again, and I look forward to seeing you all again on a future episode of the Helping Older Parents video podcast.